Hello, this is a little video to try to give you an idea of how you might make best use of your GP in the next few weeks and months ahead into the new year, but also some of the steps that we are taking to continue to see patients, but also keep everybody safe. My name is Paul Colbrick, and I'm a GP here at the Raden Street Medical Centre in Upper Mount Gravatt. We know that we've got about 4 weeks now until the Queensland state borders open. And after this, we do expect the number of COVID infections to increase significantly in Queensland for the first time. We also anticipate at this point that it will be much harder to access health services. With that in mind, we have about 4 weeks to attend to routine matters in a relatively simple, straightforward manner. Therefore, if you have any planned routine catch-ups, reviews by your doctor, annual screening tests, those sorts of things, my recommendation is that you do bring those forward and ensure you get these done in the next few weeks before Christmas. Going forwards, we know that there is likely to be more difficulty getting appointments to see a doctor at the time you would choose. So I would also encourage you to book a follow-up appointment at the end of your initial consultation. And when you are having a blood test or some other investigation, at that point in time to make sure that you lock in a review appointment with your GP to talk about the results. Going forwards, we will continue to keep patients and other people entering our building as safe as possible. This will mean that we will continue to require all people entering the building to wear a mask. We will also be seeking to reduce the amount of time that patients spend in the building, but also the number of people entering the building. This means that if you are attending an appointment, we will probably ask you to wait outside until the last moment before we bring you in. We would also ask that people only bring one carer or one child that has been examined as much as possible. We also envisage that we will continue to build on the use of telephone and video consultations to keep people safe. This means that we will probably be moving to a situation where all patients are using telehealth, that's the telephone or video consultation, as the initial point of contact. Where we need to examine people face-to-face, we will then make an arrangement to bring them into the building for a shorter period of time. This will reduce the risk of transmission of infection between patients, but also between patients and healthcare workers. With the hybrid sort of consultation, with the initial phone call, video, followed up by the face-to-face, it might even be that we bring people down to sit in their car while we do that initial conversation, and then just let them in the front door. Other times it may be two more separate appointments, but that will depend on the progress of COVID infection as to what route we go down. With people who are symptomatic, unfortunately, a number of those patients won't be able to come into the building. We will carry out an initial telephone or video consultation, and where appropriate, either send them for testing, arrange for them to be seen at a respiratory or fever clinic or somewhere else more appropriate, or make arrangements to see them ourselves here, depending on the circumstances. If you have not already done so, I would encourage you to utilise the online booking system. This will give you the best overview of the appointments that will be available and the sort of appointments that are available, whether it's a telephone or video consultation, but also when the doctor of your choosing is working and the time is most suitable to you. We also use an online an online payment system. I would encourage people to use this because it does reduce the burden on the support staff and free them up to actually talk to patients that need to book appointments or make follow-up arrangements for their doctors and things like that. So if you could use that as much as possible, it does work well. To access that online booking system, you can jump onto our website, which is Raden Street, and hit the book online button at the top. Alternatively, we do use AutoMed systems to run that appointment system for us, and you can download their AMS app and book through that service. Again, with the video consultations, this will either be through accessing it through the AMS app, but we will also use an SMS message with a hyperlink, so that you just hit that hyperlink or copy it into your browser, and then you don't need to use the app. And we're trying to make that as simple for users as possible. Really, this is an evolving situation. Things will change, and I would encourage you to keep in touch with our website and our Facebook page just for the latest updates. And in the meantime, please do stay safe and healthy, and continue to use your masks and sanitizer and social distance, no matter what the rules are from Queensland Health. If you're out shopping or in places where you cannot socially distance properly, ensure that you take all the precautions to protect yourselves. I'll say cheerio for now.